Welcome to Health Matters, the Aspen Medical Podcast. I'm your host, Eamon Quinn from the Aspen Medical Marketing and Communications team. Today, I'll be joined by a colleague, Dr. Andrew Jeremijenko, who is Aspen Medical's Group Medical Director. Andrew is a senior consultant in occupational medicine and an epidemiologist. His roles have included clinical reference lead for the Digital Health Agency, teledoctor for Matter Private Emergency, Chief Health and Medical Officer for Woodside Energy, rural and remote locum in multiple remote locations, and has provided telemedicine, emergency and occupational advice to remote sites for Origin Energy. Good morning, Andrew. Welcome to the show again.
Morning.
Andrew, just before today we're going to talk about post-COVID complexities in workers' compensation. But just to give the audience a little bit of background, with large numbers of workers continuing to work from home or to be in the office part-time, employees are asking about their worker compensation entitlements. There is a predicted increase in workers' compensation claims as workers return to workplaces and run the risk of catching COVID. In Australia, since the pandemic began, there have been around 3,000 COVID-19 related workers' compensation claims, according to data obtained by the ABC from state and territory agencies. And the two states hardest hit by the pandemic have recorded the highest number of workers' compensation claims related to COVID-19. So to start off, Andrew, the COVID pandemic has had a huge impact on workplaces in Australia and around the world. Now that people are returning to work into hybrid workplaces, what are the risks that you see?
Thanks, Eamon. Look, COVID has touched everybody. There's been over 5 million deaths across the world. We are vaccinating now. We've vaccinated over 7 billion, given out 7 billion doses, which is about 3.5 billion people have been vaccinated. And we're seeing that people are now starting to come back to work. But we're also seeing a lot of people are wanting to still do this hybrid where they're working from home and they're working, and they sometimes come to work. And now that seems to be part of the new landscape. Now, there are some complications with that. The question that was raised by a lawyer recently is what happens if you make lunch at home and you cut your finger? Is that workers' comp or not? And according to the lawyer, that's workers' comp. It would be the same as if cutting your finger while you're at lunch at work, making yourself a sandwich. So really, it's much more complex now. The whole workers' compensation and where you're injured, it used to be either you're injured at work or if you're injured at home, it's not workers' comp. But now that we've got these hybrid workplaces, injuries at home can actually be compensated.
All right. So we know workers' compensation can be a big expense. How can organisations manage that particular cost?
Well, firstly, with COVID, we've got two issues. We've got a COVID infection in the workplace. Now, if that actually can be proven to be caught in the workplace, then it is compensable disease. And particularly if a person is very sick, gets long COVID, potentially can even die from this, it can be a very large expense. So that's why organisations are, again, a lot of advice, both legal and medical advice, to work out what they can do with vaccinations. Can they make it mandatory for people who come to work to be vaccinated? And this is not, for me, it's simple. I would say, yes, you have to. This is, you've got a workplace. If you spread the disease, you have to get them vaccinated. But that's the doctor's view. The legal view is it's much more complex than that. You have to be able to prove that it is a risk and a health and safety risk. And look, I'm not a lawyer, so I'm not going to talk about how you have to go through that whole process. But when I've done this with other companies, it's actually been quite a long process. We've had to go and do very complicated health risk assessments. We've had to use statistics. We've had to prove that this is a risk that needs to be managed. And only then, and after the legal people have approved it, can we then say it's mandatory to have vaccination to come to the workplace. So I think there is some places that just make it mandatory, totally mandatory. You can't work, like healthcare workers. So for healthcare workers, you have to get vaccinated if you want to go work in a hospital. And if you don't get vaccinated, you lose your job.
And I guess that's why, I mean, it is a complex area. As you've pointed out, there's areas of law, there's areas of medicine, and I suppose that's why people would come looking for advice. It's not simple. You've got to talk to experts, which I guess is exactly why we have a global advisory services team, of which you're one of the people who support that. So, I mean, right. that kind of ties that together. It is a complex area. But don't organisations already have injury management systems in place?
Well, they do, but as I said, this is complex. So long COVID, is that an injury because you caught it at work, or is it an illness? And there's a fine line. But in occupational medicine, we have occupational diseases, and it can be an occupational injury or an occupational illness, like asbestos causing mesothelioma. If you work for an asbestos mine and you've got mesothelioma, that's compensable. With long COVID as well, I mean, if you've caught that at work, that's a compensable thing. And then what about all the mental health issues that we're seeing because of quarantines, because of isolations? We've got this massive increase in mental health. Now, anyone who's worked in workers' compensation will know that stress and stress at work has been going, bullying at work, sexual harassment. I mean, there are so many complexities now in workers' compensation. It really makes it very, very complex. So I think for long COVID, that's a real issue. And for mental health, that's a real issue. And when you're dealing with hybrid workplaces, that makes it even more complex. And it's really important that companies start thinking about these complexities and how they're going to deal with it. You want to be able to care for your employees and give them the best care possible. But you do have to be prepared for these new diseases that are basically coming from the COVID pandemic and from the changed environment due to the COVID pandemic.
Okay, you mentioned mines. You mentioned mining sites there a couple of minutes ago, Andrew. Yeah. And I know from our chats and from your background that you've a considerable amount of experience both within mining and oil and gas. Yeah. They're dangerous. They're perceived certainly as dangerous workplaces. And what are organisations in this sector doing?
Well, the reason why I bring mining in is because I've always been impressed. Basically, wherever there's lots of energy, like oil, things can explode. And there have been terrible accidents where rigs have exploded and people have died. So because of that, the mine sites and the oil and gas and resource sectors have developed a very strong health and safety program. And really, if sometimes I feel other organizations, education, even health, can learn from the resource sector. They're really good at identifying risks. They're really good at managing those risks. And they actually measure them as well so that they know that what they're doing works. And then if someone does get injured, they're extremely good at getting them back to work. So they watch their LTIs. Now, a lot of this is also to do with contractual stuff. I mean, basically, if their HSE, if they don't have bad statistics, they're less likely to get their contract. So they're very careful to make sure that they manage all their injuries. And what I've seen, and what I call it the culture of caring. So initially it was, I work in hospitals, I'm a doctor. So we don't have a pre-day tool meeting where we go through all the risks that the doctors and nurses might like picking up a heavy patient or pushing a bed or like someone falling and trying to catch them. We don't do that. But if you go to the resource sector, they're always having these, tool meetings where they have pre-job work meetings and they talk about the risks and they identify the risks. You've got to get little permits, to work in a hot area, which is an area that could explode. So they've got a lot of procedures and a lot of policies around health and safety. And that's really actually made a big difference. And what we're seeing is that mine sites have, despite them being more dangerous, it's actually 10 times safer to work in a mine site than it is to work in a hospital, just as an example. So I think actually a lot of organizations can learn from the resource sector. You can have this sort of cross-fertilization. But I don't think that people realize they do. A lot of companies, Coles, Woolworths, the hospitals, they'll have injury management programs, but they'll be able to be improved. And if you compare their statistics and the data to places like the resource sector, they're not doing very well and they could do a lot better.
Which is a nice lead in to the fact that if they want to do a lot better and they want to make this a little bit better for themselves, they should be taking actions. They should be talking to the right people. And I guess, where would organizations go to for this kind of advice?
Well, as I said, it's a very complex area and it's getting more and more complex. But as an example, I worked with an organization and they had pretty bad statistics, basically. They were worse than theirs. They were comparing, they were benchmarking against another group and they were worse. And so they came to an occupational physician we sat down, we did a plan, and it actually took about 3 or 4 years to change things, but they actually became twice as good as the organization they were benchmarked against. And what that meant is that instead of paying $6 million a year in insurance premiums, they started paying $3 million a year in insurance premiums. And instead of having 40% of their people when they get injured take time off, they only had 40% of people stayed at work when they got injured. But then they went up to 80% of people stayed at work. They were put on light duties, they were supported, they were sent to physios. And this made a massive difference, not only to the premiums. So they saved something like $20 million. I worked with this organization for about 10 years. And I said it took 3 or 4 years to get there, but then over 7 years, we saved about $20 million just in premiums. That didn't include all the workers' compensation legal cases or the lawyers' fees, anything like that. That was just in premiums. So they saved a massive amount of money by getting good advice and by implementing a really strong program. And I actually think that there's a lot of companies there who think that they know workers' comp and they think they know how to manage injuries, but they actually need some advice. And it's really about the culture of caring. It's really about realizing that every injury is an opportunity to, 1, improve your workplace, and 2, to care for your worker and make sure he gets better fast and gets back to work. You know, when you lose an employee, you lose a valuable resource. All the training, everything that's gone into them over the years and years and years, they are actually really important parts of your organization. And it's really, really important for people to start thinking about how they can better care for their workers.
Andrew, obviously with expertise such as your own as an occupational medical specialist, it's people like yourself that people should be talking to when they're trying to get through this minefield, so to speak. And that's why we have a global advisory services team to help people in all sectors navigate this.
Can I just add one more thing, Eamon?
You can.
Because it's not just me. I only do the occupational medicine side. But there's a whole environmental side. So obviously in resource companies, you've got to measure noise. Now you need an industrial hygienist for that. There's environmental exposures, asbestos, coal dust. And in say, hospitals, you've got chemotherapeutic drugs or what we call biological agents that can actually cause, infections or chemotherapy drugs can actually cause problems with miscarriages and learning disabilities. And so potentially there's a lot of other issues that it's not just medical. And that's why we have an advisory group. As I said, you need some legal advice as well. But on the medical side, you sometimes need public health physicians because they need to deal with infection control specialists. You need environmental specialists, industrial hygienists, occupational therapists, physiotherapists, doctors, occupational medicine specialists. There's a whole range of people that are sometimes required to actually make this work. It's not as simple as, let's just go talk to someone and it's going to get better. It is actually a long process. It does take time and it does take commitment from management to bring these changes. But the payoffs are really, really big. So for your investment, it's only a small investment, but the return on your investment can be actually massive. We're talking millions of dollars of savings here. And I just think companies need to be aware that they can do things better. People are doing not a bad job, but it's getting much more complex and you need advice. And if you do get the right advice, you can actually do better. And it saves you money, you care for your employees. And the other great thing that we're noticing is that the value of companies that do this goes up on the share market. So they've now got lots of studies that show that companies that focus on health, safety, and environment actually do better than companies that don't. And I think that's a reflection of you taking care of your workers, the culture of caring. It actually does make a difference. The human resources are very, very important. You've got to take care of them.
Dr. Andrew Jeremijenko, Aspen Medical's Group Medical Director and somebody who closely supports our Global Advisory Services team. Andrew, thank you so much again for your time today. Appreciate it.